The rising trend of political violence by political players has become a major concern among members of the public, such as traders and marketeers in the country.
Last time nabwana siana sampwa katundu hapa kusia sono tawira mshopu no isia katundu tawisa che moyo wanga ta ni pulumukeko che ija violence inesinifuna maningi.
And if not aggressively addressed, this rising political violence may have devastating effects on the country's social, political and economic growth.
Tugudizane bonse tendele pamozi tupange vintu tende pasogoni noti jako bati tukayamba benangu bataba koma mamaketi mashopu bonse bavara siwa maiti
tufuna munga ma election yankale mu order yankale mu peace yale nikamba pone akwe bati noti tikazuna abantu afuko bati batamanga mapanga ja netezona hapa cha kudala so tufuna peace.
These traders' worries have now eased up following the Zambia Episcopal Conference decision to convene a meeting for all political parties to find a solution to political violence in the country. The convening of this meeting at the Cathedral of the Holy Cross in Lusaka has cheered traders.
Chipempa kuti mulungu wakate mumutima pana kita declare ino country ni Christian country lekani zao mulungu zionekere pali abasogolera amene atisogolera ku chifuka abantu amene bali basogolera ni bantu ba mulungu amakalipa abantu amene bataba
so katika mkuvota tipu yetu mukugwisa kuno kwini Zambia miziko ya mtendero Stephen kutamanga msiko lake tapapa kutamanga Stephen.
The political party leaders committed to end political violence ahead of the August general elections. The onus is now upon the law enforcement agencies to ensure that all perpetrators of violence are sternly and impartially dealt with in order to create a just society. Tony Nkoma reporting for Zanis in Lusaka.
The Zambian government in 2014 released 120 million kwacha for the construction of 30 chiefs' palaces across the country. The project, which is in phase 1, includes a chief's palace, queen's quarter, and a museum with an office block for the chief. In each province, 3 selected chiefdoms are to benefit in phase 1 of the program. In Luapula province, from the 1.2 million kwacha allocated, will benefit Chiefs Munkanta, Chieftainess Kanyembo, and Chief Mununga. Recently, Minister of Chiefs and Regional Affairs, John Kufuna, toured Luapula province to inspect the newly constructed palaces. Mr. Kufuna visited Chieftainess Kanyembo's palace in Chelenge district.
Those that are still at foundation level, what is the point in giving them money when they are still at the ground, they are not yet finished with the project that we gave them at the beginning. So they have to finish whatever they are doing before they could be given their money. So we want Luapula to take a lead. Let them not relax where they have reached. They have done very well. Let them finish so that we give them some more money.
The minister had good news for Chiefs Affairs officers.
We have got money for the construction of their Royal Highnesses' palaces, but we can't disburse this money when we can't see a proper thing being done. But when immediately they finish, we are going to give them more money so that they construct other palaces, which is the second phase.
Chieftainess Kanyembo expressed gratification with the construction works of her palace.
President weso achakwalungu na babomba ifishinga bomba abantu bonse ama president yafumako.
And Provincial Chiefs Affairs Officer Noah Mwisa stressed to the minister that the project will require more funds to complete.
When you look at the massiveness of this construction, I think it requires more than 400,000, considering other costs that are administrative. So I think we'll go back and see look at the people who are involved in the procurement and to talk to them to see to ascertain how much is required for them to start the roofing level.
The continued efforts by government to construct chiefs' palaces across the country will uphold the dignity to the chiefs and their subjects. Reporting for Zanis News in Chelenge District, I am Kwachi Sinyangwe.
Electricity plays a vital role in any learning institution, as many subjects require the use of electrical appliances. However, since its construction in 1965, Mupambe Primary School in Copperbelt's Mufulira district was not serviced with electricity. This posed a challenge to the school, which also conducts night classes for adult learners. However, this is now a thing of the past, as government has completed an electrification project at the school at a cost of 180,000 kwacha under the Constituency Development Fund, CDF.
Government looked at community needs, and one of them was the issue of electrifying this school so that the learning environment by our pupils could be improved. So with this, the government under CDF funding was able to inject in 180,000 in 2014, and this project was officially commissioned in 2015.
The electrification of the school has come at the right time, as the newly introduced Information Communication Technology ICT subject cannot be taught without electricity.
It has benefited us, the members of staff, including the learners. The members of staff, by the nature of having the fridge, stove, even using the ICT. Then with the learners, as at now we have the new curriculum where there is the ICT. It has been easy for them to use electricity than before.
The coming of electricity to the school will definitely have a positive impact on the performance of pupils at Mupambe. Rachel Mshala, Zanis News, Mufulira.
The provision of primary health care cannot be complete without mentioning the critical role of nurses and midwives in the health sector. However, for many years, the country has had fewer training schools for midwives despite their pivotal role in attending to maternal cases. But government has embarked on a project to open Lukupa Midwifery School in Kasama district in a bid to train more midwives.
The Ministry of Health has indicated that they are going to send us the consultants by the end of this first quarter, which means by 31st of March, those consultants will come through. We shall have one consultant in Obs and Gyne and a senior registrar. So all those, once they are put in place, then we are earmarking June intake. We should be able to recruit.
And Dr. Walia is certain that the opening of the institution will enable expectant mothers to receive adequate care and support from health staff.
The fact that we are talking about increasing the skilled deliveries, and once we have skilled attendance to any woman who is giving birth, we expect that the number of maternal mortalities, the number of women who are going to die in the process of giving birth, is going to drastically reduce.
And Kasama residents have welcomed the opening of Lukupa School of Midwifery in their locality.
Kanchina ifodi ishu kweli kalambe chine muno mukasama mu Lubemba na tutemwe chine chichintu na babombesha pantu na ifona batulanguluka fo bena kasama.
We are very much happy with the government for introducing a school of midwifery, because midwifery play an important role in societies. So it's very important to deliver under a qualified midwife, because whenever you have a problem or immediately they discover that you have a problem, it's very easy for them to know what next step to take.
The first intake of students at Lukupa School of Midwifery is set for mid this year, and so far logistical arrangements for the official opening of the new training center are in progress. Reporting for Zanis, I'm Chilvia Kalenga in Kasama.
Reducing distances covered to access quality health services in rural areas is top on government's agenda. In Ngawe district, Kateneka area, government is constructing a health post and a staff house. This has cheered the residents who used to cover 15 kilometers to access health services. Charles Chitambo spoke on behalf of the residents.
Okutotera tukwete kulipakwe batu kufuma pano kuya pa Mumbachara kliniki pali distance 15 kilometers. So kuli problemu ikuluya kwa bati abengi abakweta abana bano balafiwa kusenda abana babiri okubatwala ku under 5 kuyakuti. So nachikwatira ensansa pakusanga kwati kliniki yabera mupeke.
And Ngawe District Administrative Officer Jesse Mlenga says the intention of government is to take health services
closer to the people.
These people here, they have been traveling more than 15 kilometers to access health facilities. But now, when this facility is completed, it means that the community will have the facility near them. Then in case of emergency, they will just rush to the clinic and they will be attended to.
The contractor, Tint Construction, has assured that the project will be handed over to government this month.
We are doing the health post and the staff house. Actually, we have done 85% of works, and you can say 15 we are likely to finish this month. We are going to hand the project to the relevant authorities, the government. The
completion of this health post will surely help reduce the distances covered by the residents to access quality health services. Reporting for Zanis in Ingabwe District, Central Province, I'm Kelvin Tembo.
It has always been said that today's children are tomorrow's future, and to achieve this, there must be a conducive environment for them to grow. Good nutrition is a critical factor, especially in the first 1,000 days of a child's life. In Chipata, the District Nutrition Coordinating Committee, DNCC, is working with stakeholders such as MAWA, Scale Up Nutrition Sun, DAP and various government departments to improve the nutritional status of children. DAP is making a commendable contribution.
So in our research we found that we had 36 children that were in yellow and 11 that were in red. And those that were in red, we referred those people to hospital. And then we also continued working with their parents, their mothers, teaching them how to feed the children. And good enough is that all of them have recovered except for one who passed on. Then for those 36 that were found to be in yellow, yellow is a category where it means that the health is going down. So meaning that any time the child can now move into malnutrition. So we worked with the parents, conducting cooking demonstrations, lesson on how to feed the child, feeding practices. So the parents were cooperating, and good enough, all of them they have improved, and they are now in green, which is the health category.
The Mumbwa DNCC was in Chipata on an exchange program and learned something from their counterparts.
Because what matters is what is happening in the community, because we can do all these trainings and leave people out there and nothing is happening. But with the feedback coming and the reports being shared, I think this is the way to go, and I think we are going to implement this model to some extent. I believe it's something we can do within the resources that we have.
Scaling up nutrition is important as it determines the future health of today's children. And improving nutrition, especially among rural communities, can easily be achieved as crops with nutritional value are found in their backyard. Zanis reports in Chipata, Eastern Province.